Hello and welcome to my channel, where I share useful information and tips about various health topics. In this video, I'm going to talk about kidney transplantation, a surgical procedure that can save the lives of people with kidney failure. I'll explain what kidney transplantation is, what are the benefits and risks of it, what medicines you need to take after it, and what diet you should follow to keep your new kidney healthy. If you find this video helpful, please don't forget to subscribe, like, share, and comment. Thank you for your support. So, what is kidney transplantation? Kidney transplantation is a surgery that involves replacing a damaged or diseased kidney with a healthy one from a donor. The donor can be either living or deceased. The donor kidney is placed in the lower abdomen of the recipient and connected to the blood vessels and the bladder. The recipient's own kidneys are usually left in place unless they cause problems such as infection or high blood pressure. Kidney transplantation is usually done for people who have end-stage renal disease, ESRD, which means their kidneys have lost about 90% of their function and can no longer filter the waste and fluid from the blood. People with ESRD need to have dialysis, a treatment that artificially cleans the blood using a machine, or a kidney transplant to stay alive. Kidney transplantation has many benefits compared to dialysis. According to the National Kidney Foundation, some of the advantages of a successful kidney transplant are: 1. Better quality of life. 2. Lower risk of death. 3. No need for dialysis. 4. Higher energy levels. 5. More freedom and flexibility. 6. Fewer dietary restrictions. 7. Improved sex life and fertility. However, kidney transplantation also has some risks and challenges. Some of the possible complications of a kidney transplant are: rejection. This is when the recipient's immune system attacks the donor kidney as a foreign object. Rejection can happen at any time after the transplant, but it is more common in the first few months. Rejection can damage or destroy the new kidney if not treated promptly. Infection. Because the recipient has to take medicines that suppress the immune system to prevent rejection, they are more prone to infections from bacteria, viruses, fungi, or parasites. Infections can affect any part of the body, including the new kidney, and can be serious or even life-threatening. Surgery-related problems. As with any major surgery, there are risks of bleeding, blood clots, wound infection, nerve damage, or injury to nearby organs during or after the operation. Side effects of medicines. The medicines that prevent rejection have various side effects that can affect different organs and systems in the body. Some of these side effects are: 1. Bone thinning and damage. 2. Diabetes. 3. Excessive hair growth or hair loss. 4. High blood pressure. 5. High cholesterol. 6. Increased risk of certain cancers. 7. Kidney damage. 8. Liver damage. 9. Stomach ulcers. Recurrence of kidney disease. Sometimes, the original cause of kidney failure can come back in the new kidney and damage it over time. This can happen with diseases such as diabetes, glomerulonephritis, lupus, or polycystic kidney disease. To reduce the risks and complications of a kidney transplant, it is very important to follow the instructions and advice of your transplant team. They will monitor your condition regularly and adjust your treatment as needed. You will also need to take good care of yourself and your new kidney by taking your medicines as prescribed, following a healthy diet, exercising regularly, avoiding smoking and alcohol, and protecting yourself from infections. One of the most important things you need to do after a kidney transplant is to take your medicines exactly as your doctor tells you. These medicines are called immunosuppressants or anti-rejection drugs. They work by lowering your immune system's activity so that it does not attack your new kidney. You will need to take these medicines for as long as you have your transplant. There are different types of immunosuppressants that work in different ways. Some of the most commonly used ones are: 1. Steroids, prednisone. 2. Cyclosporin, Sandimmune, Neoral, Gengraf. 3. Tacrolimus, Prograf. 4. Azathioprine, Imuran. 5. Mycophenolate, Celcept. 6. Sirolimus, Rapamune. Your transplant team will decide which combination of immunosuppressants is best for you based on your condition and your donor's compatibility. They will also tell you how much and how often you need to take them. It is very important that you do not miss any doses or change your dose without consulting your doctor. If you miss any doses or take too much or too little of your medicines, you may increase your risk of rejection or infection. If you have any questions or concerns about your medicines or their side effects, talk to your doctor or pharmacist. Another important thing you need to do after a kidney transplant is to follow a healthy diet that supports your new kidney and your overall health. Your diet may be different from the one you followed before your transplant or while you were on dialysis. Your doctor and dietitian will help you plan your diet based on your individual needs and preferences. Some general guidelines for a healthy diet after a kidney transplant are: 1. Eat more fruits, vegetables, and whole grains. These foods are rich in fiber, vitamins, minerals, and antioxidants that can help lower your blood pressure, cholesterol, blood sugar, and inflammation. They can also help prevent constipation, which can be a problem for some people after a transplant. 2. Choose lean meats, poultry, fish, eggs, beans, and low-fat dairy products as your sources of protein. Protein is essential for building and repairing your muscles, tissues, and organs. It can also help fight infections and heal wounds. However, too much protein can strain your new kidney and cause dehydration. Aim for about 0.8 grams of protein per kilogram of body weight per day, unless your doctor advises otherwise. 3. Limit how much sodium, salt, you consume. Sodium can raise your blood pressure and cause fluid retention, which can affect your heart and your new kidney. 3. Try to limit your sodium intake to less than 2,000 milligrams per day. Avoid adding salt to your food and choose low sodium or sodium-free products. Read food labels carefully and watch out for hidden sources of sodium such as processed foods, canned foods, sauces, dressings, soups, snacks, and fast foods. 4. Count carbohydrates or sugar intake. Carbohydrates are the main source of energy for your body. They come from sugars and starches in foods such as bread, rice, pasta, potatoes, fruits, milk, yogurt, sweets, and desserts. However, too many carbohydrates can raise your blood sugar levels and increase your risk of diabetes. This is especially true if you take steroids or other medicines that affect your blood sugar. To control your carbohydrate intake, you may need to count how many grams of carbohydrates you eat at each meal and snack. Your doctor or dietitian will tell you how many grams of carbohydrates you need per day and how to distribute them throughout the day. 5. Follow a heart-healthy diet low in trans and saturated fats. Fats are an important part of your diet as they provide energy and help absorb some vitamins. However, some types of fats can raise your cholesterol levels and increase your risk of heart disease. These include trans fats found in hydrogenated oils and baked goods, and saturated fats found in animal products such as butter, cheese, cream, fatty meats, and lard. Limit these fats to less than 10% of your total calories per day. Instead, choose healthier fats such as monounsaturated fats found in olive oil, canola oil, nuts, seeds, and avocados, and polyunsaturated fats found in fish oil, flaxseed oil, soybean oil, sunflower oil, corn oil. 6. Stay hydrated by drinking plenty of water and other fluids. Water is essential for keeping your body functioning properly. It helps flush out waste products from your new kidney and prevent dehydration. It also helps regulate your body temperature and blood pressure. Aim for about 8 to 10 cups of fluid per day unless your doctor tells you otherwise. You may need more or less fluid depending on your urine output, weight changes, weather conditions. 7. Avoid alcohol and caffeine. Alcohol can interfere with some of the medicines you take after a transplant and damage your liver. It can also dehydrate you and raise your blood pressure. Caffeine can also dehydrate you and raise your blood pressure. It can also affect your sleep quality and increase your anxiety levels. Limit or avoid drinks that contain alcohol or caffeine such as beer, wine, liquor, coffee, tea, cola, energy drinks. These are some general tips for a healthy diet after a kidney transplant. However, your diet may vary depending on your individual needs and preferences. Your doctor and dietitian will help you plan a diet that suits you best. I hope this video has given you some useful information about kidney transplantation, its benefits and risks, its medicines, and its diet. If you have any questions or comments, please leave them below. And don't forget to subscribe, like, share, and comment on this video and my channel. Thank you for watching and stay tuned for more videos on health topics.